Hello and welcome, team. I'm Dr. Amir Khan, and we're starting another episode of Khan Clinics. Today, we've got a very interesting topic. Some of a topic that you have mostly all of you come across a person or two, um, and seen and heard, and probably encounter someone like this. So today's topic is basically on stroke. We want to look into what are the measures one can take to prevent um, stroke from happening. That would be part of the discussion. But the second part really will be on, can you act promptly? Can you identify someone who is probably likely having a stroke? And then the thrust is, why is it important for you to identify that? This is not that you have to be a medical related in the medical field, but just seeing someone on the street, a loved one, or someone you're looking after, or an elderly patient, or someone. So this is what we're going to be talking about. So Jeremy is going to run up your first video for us, and then we'll follow up with a discussion, introduction for our guest, and then a discussion on this.
When someone is having a stroke, every minute counts. Just as putting out a fire quickly can stop it from spreading, treating a stroke quickly can reduce damage to the brain. If you learn how to recognize the telltale signs of a stroke, you can act quickly and save a life, maybe even your own. For both men and women, look for these 5 signs of a stroke, all of which come on suddenly. 1. Numbness or weakness in the face, arm, or leg, especially when felt on just one side of the body. 2. Confusion, including trouble speaking or understanding speech. 3. Trouble seeing, from one or both eyes. 4. Trouble walking, or problems with balance or dizziness. 5. Headache, especially a severe one that comes on suddenly. The clock begins ticking as soon as you spot the signs of a stroke, because some treatments can only be used if the patient reaches the hospital in the first 3 hours after symptoms appear. So don't wait. Call 911 right away and get the person to a hospital immediately, even if the symptoms go away. If you think someone is having a stroke, remember the word FAST. F is for face. Ask the person to smile and check whether one side of their face is drooping. A is for arms. Have the person raise both arms and see if one arm drifts downwards. S is for speech. Ask the person to repeat a short phrase and notice if their words sound slurred. And finally, T is for time. If you spot any of these signs, call 911 right away to get the person to a hospital fast. Strokes are medical emergencies. The sooner a patient gets treatment, the better their chance of a good recovery.
So very good. That was quite nice. Thank you, Jeremy, for playing that. And basically, it leads into our topic. We're gonna have today. Our guest is gonna be Dr. Wajiha Awan Kiran. She's a medical physician, a graduate of 2018, and has done her FCPS Part 1 as an advanced qualification. She's also a mother. Dr. Wajiha, can you hear us?
Yes, sir, I can hear you.
How are you today?
Yes, I'm doing good.
You're doing good?
How are you?
You pick up a very interesting topic.
Yes, sir.
So, how about walking us through what we have sort of like preliminarily heard, and then we can have a discussion as we go along. And I think
Yes, sir, sure.
the fascinating part for all of us is that when we saw this bit on fast, and you know, it's such an important aspect, and yet we have not really keyed into it in daily life. And as we know that if you see someone collapsed and on the floor, and then you should start CPR, we should, at the same token, if we see a patient probably or likely having a stroke, just like they're having a heart attack, there are some do's and don'ts. And we want you to see if you can walk us through that. Me and Jeremy, myself, and Maya here are very interested to see what's there, some do's and don'ts to do. So I'll give you the mic and please go ahead, Dr. Want walk us through.
Okay. Thank you, sir. So first of all, I'm Dr. Wajiha, and today we are going to have a discussion about the topic stroke. So, what is basically a stroke? Stroke is when there is a blockage or the bleed
Dr.
of the
Wan,
blood
your voice
vessels.
is a little bit distant. It was better before, but now it's a little distant.
Okay, sir. Is it better now?
Yes, it's better.
Okay. So let's start with the concept that what is stroke. I guess most of the people are familiar with this term. So stroke is basically that when there is a blockage or the bleed of the blood vessels, which either interrupts or or reduces the blood supply to the brain. And when there is decrease in the blood supply to the brain, then it results in the insufficiency of delivering of oxygen or nutrients to the brain, which then results in the brain cells to die. So, what should we do? What is the key point here? That how should we react when someone is having a stroke, or if a person himself or herself is having a stroke? So, first thing is that the signs and symptoms of the stroke are very sudden and very serious. So we should not miss those, and we should not wait to see if symptoms go away. And this is not an option at all. So we have to react immediately. So let's see what are the symptoms which anyone should be keep in mind. Okay, so we should keep an acronym Be Fast in our mind. So let's go in detail. What is Be Fast? As in balance. So when someone is feeling dizzy, we have to ask that if there is a sudden loss of balance, or or a person is feeling dizzy, then E as in eyes. Eyes means that is there any difficulty in vision? So we have to ask the person that if there is sudden changes in the vision, or there is a blurring of the vision, or if there is a doubling of the vision. And then F as in face. So we have to ask the person to smile. And if one side of the face droops or there is a numbness, then it is an alarming sign. And then A as in arms. And we have to ask the person to raise both the arms. And if there is any weakness or numbness in one side of the arm, then we should be worried about that. This is a very important sign. And then S as in speech. We have to ask the person to repeat a simple phrase. If they are having difficulty in speaking or understanding your speech, then this is also an alarming sign. And then T as in time. Time is the key here. If you, We should not wait to see if the symptoms go away. We should call 911 if you observe any of these signs immediately. Because the
Gotcha.
longer the stroke will left untreated, the greater will be the potential for brain damage and long-term disability, and the person will take a long time to recover.
So, Dr. Wan, there is a timeline that you can give an excellent sort of therapy if you identify a type of stroke or one of the commonest types of stroke. So it's like you were saying. So would you mind just repeating again? Fast. F is for
Face,
identifying the
uh,
face. What
face,
do you do
yes,
in the what do you see in the face, for example? What do you identify? We said FAST. F is face. What do we see in the face? There is.
uh, there will be drooping or numbness on the side of the face because we have to ask the person to smile. When they smile, then the one side of the most in mostly cases, one side of the face will show some drooping or some numbness.
Excellent.
So
So
yes,
excellent. So that's Dr. Awan, a very big sign that their
Yes.
face is not symmetrical all of a sudden. And then when you look at them, you can tell something is not right. That means you have to, at that time, or one has to, at that time, pay some attention. Because if we're thinking that, oh, he's joking or something, or there's some anomaly, you gotta speak out immediately. And so it's a very, very subtle time. It's a subtle sign. Sign, not a symptom. Sign is when we pick up something. So, face, I'm just telling Maya here, is that, oh, I see you a lot, but this looks a little different. And a lot of times that your nasolabial folds disappear. They disappear. Or you can see the smile, there is now a tilt on it. So F is very, very important in the fast. What about the A? A is the
Arms. A is as in arms.
arms. Okay, yes. And I see here someone saying the face, you could have a condition which is called Bell's palsy, but that's different and facial palsy. And but yes, there is some form of muscle abnormality. A is arms. So immediately, what's the next step we should do as far as the arms or the legs or something? If they are standing, you tell them to sit down. But what about the arms, Dr. Awan? What happens?
Uh, we have to ask the person to raise both the arms because in most of the cases there is abnormality on the one side. That is the most common type of stroke, and the person will feel weakness or numbness in one arm. So the person will be unable to raise the arm properly or could not feel.
So you're saying that's the next big red flag. Hey,
Yes.
something's
Yes.
not right here. The arms are not functioning as they normally should do. You ask them to reach out, you ask them to give you something. They're not able to lift. They may not be able to lift, or they may not be able to perform. But the facial droop, if they already have a facial droop, so so a question to the audience is very interesting. Should do you need to be having both? Do you need to be having the and the face, arm and the face together to identify? What if one is there and the other one isn't? For example, someone says I can't lift all of a sudden. Is that a red flag? Maya, what do you think? Is that a red flag? Someone saying could he or she be having a stroke now that the face looks all right, but it is just now the arms and stuff. Could they be having a stroke? Could it be part of the yeah? Right, there's something's not right, and arm you have to. I'm seeing a lot of people saying no. You arms on its own can. You if you look at a bigger picture, there in the cerebral cortex, the body is drawn there. And if a stroke just involves the arms or the legs, it may be possible that they're having uh, an isolated part being affected. So you don't necessarily have to have both. Generally, you do have the face and the legs or the arms, but even if you're having one, it should alert you. It should alert you that, oh, this is something that we have to act and something may be going on. So that's just another little point. Or you see them, they were standing and all of a sudden they just collapse and they're on the floor. That's just their legs gave way. They just had a quick, rapid weakness of the legs, one side or both, and they're on the floor. All right, Dr. Awan, you agree?
Yes, sir.
It depends on which part. Yes, absolutely. We see here is saying even the thrust, like I said today, is discussing this fast part, and that if you're sitting next to a person, um, you're gonna act. And that's the take home message for this: is you're gonna act and you're gonna act fast, because like I said, generally you gotta get them with an IV line, that's an intravenous line, and an access in a facility within how much time? Generally. So they can have their they can have their first line of treatment, which is very effective. How much time do you have to get them in? Generally, pardon me, an hour. Yeah. Well, I want to hear what the team says about this. How much time do you have to get them at a place? Now, heart attack, generally, you have to be prompt. You got 5 minutes, you may have 10 minutes, depends upon the severity. You may have less, you may have more. It may resolve, it may not. But if you're having a full blown stroke, and there is especially one treatment that is out there, how much time do you have to get them in for that treatment? There's sort of like a min and a max for it. So I want to see. This is the key. That's why we're just saying here you're gonna act fast. Why do you have fast? Act fast because our aim is to get them into a hospital and a facility that can identify what they have and give them that treatment. So right at time. So I'm getting missed messages. So with you, I'm getting something 20 minutes, something 30 minutes of that treatment, something half an hour. You got half an hour. Let me ask a very interesting other question. This happens a lot. You go to bed, you sleep, your loved one sleep, and you wake up, and you go to the bedroom where your loved one is, and you realize they're having a facial droop there, and you do not know when was the onset. What do you do then? Do you act fast? Still gonna act fast, right? So we're still gonna act fast, but now we don't know when the onset of symptoms were. So just keep that specific sort of situation in mind. The onset matters. So if that's why when you see someone during the daytime and you're looking, so this is very important from a critical care standpoint as well. When we practice, we want to try to know when they went to bed, when was the last time someone saw them, when was the last time they used their phone, or when did they try to reach out to someone. This is very important. And just a number, I've had so far a lot of responses regarding rush ASAP, go to ER, but the cutoff point to give this specific clot buster is 3 hours. It is a good window, but it gets a little complicated if things get delayed. You're out in the periphery. You realize you just found someone and you don't know how long the person was down for, and then you think the patient is having a stroke. All right. So I'm gonna let Dr. Awan continue on the one other sign that you wanna quickly ask or pick up, and that's we got the F, we got the A, which is the arms, we got the S, and that's Dr. Awan. You said it was the speech part. So what do you do there, doctor?
Uh, First of all, we have to ask the person to repeat a simple phrase. Like we can ask them to repeat their name or say it like that. My name is whatever the name is. So the person will not speak as they are used to. There will be some blabbering or mumbling voice, or they will not be able to complete the phrase properly.
Very interesting. So if the stroke is involving the tongue or the muscles that are controlling your speech, you'll have a slur. You'll know that there is missing sentences or not making sense, and he may or may not be confused in addition as well. And then the T is the timeline, right? So we just had a brief chat about what is the timeline. We got T to first before we could get to the S part, I guess. So please, everyone, just make a note of this FAST. This is sort of like essential, the fast part. And I know you've got a deadline. Some of them do extend. Okay, you've got 3 hours. Sometimes there is literature suggesting, it may be extended to 4 hours, 4.5 hours, but definitely not over 6 hours or 8 hours for a specific type of treatment for the for the stroke. So we got to identify. That's what Dr. Awan is going to discuss and discuss with us. Go on, Dr. Awan.
Okay. And sir, I want to mention one thing here that all these symptoms are sudden. Like these are not from a long time, as one person asked for the Bell's
That's a
palsy.
very good
So
point.
Bell's
That's a very
palsy
good
is
point.
a prolonged condition.
So if you see, you're saying that you gotta see these symptoms all of a sudden. It's like
Yes.
just happened now. It's not like someone says, "Oh, I've been having pain for weeks," or "I've been having arm pain." That arm pain is different. When there is a sudden collapse in your arm or your leg, and something acutely has gone down, that's when you're saying there is an issue. And I think your next slide is wonderful because it's going to show which are the patients more vulnerable, right, Dr. Wan?
Yes, sir.
Walk us through
Okay.
that, please.
Okay. So first of all, we have the stroke, which has different set of potential causes. So most common causes are when the patient is overweight, when there is obesity and the BMI is above, you can say, 30 to 35, and age factor, when the person is 55 years of age or older than that. And then there is a personal or family history of stroke, and considering the diseases, when person has hypertension, that is raised blood pressure, have diabetes, high cholesterol, heart disease, or any other vascular disease. And some things are modifiable, like these are the lifestyle conditions which may be the cause of the stroke. It is the sedentary lifestyle, and when the person is not exercising or just lying down and not active much, or just sitting in the office or not doing the exercise and stuff. So the sedentary lifestyle, and then consuming alcohol excessively, smoking, and use of the illicit drugs.
Brilliant.
So all of these are very common causes and the risk factors for the stroke.
So I've just asked a question that's quite brilliant. I think I've just asked a question to the team members. Of all these risk factors, Maya, you got obesity, you've got age, you've got previous history of a stroke, you got blood pressure. There is one that you need to be more aware of than the others. Which one would we think it is? That is the one that is a very high risker. It makes the person a very, very high risk one.
I guess steal my answer from the chat and
Yeah,
say old age.
old age is one. So people. So let's say age is a obviously an important one because you could see if they're elderly, they're more chances of having. But let's say the second most important one then. I want to put a little bit so it's the second most one, which is actually the most one that you want to focus on. It's also in the chat. I think a lot of people have got that right. Blood pressure.
Blood pressure.
Yeah, the blood pressure is one that could be the cause of why you're having everything, right, Dr. Wan? That's one of the ones that I wanna.
Yes.
Of all your list there, I know you have the age. You know your elderly people. I guess you're right. That's one of the most important one. But this is fantastic. Everyone sort of most of the people picked up. I know the blood pressure and the age. I know diabetes, cholesterol. They all matter. They all are relevant. But when you are having a stroke and you got to fast from critical care perspective, when the patient is being rolled in, the first question we want to ask is, what's the blood pressure doing right now? Because you've got to bring that under control most of the time on a reasonable range very, very quickly. Very quickly. You got to drop the blood pressure, control it, because that could be very intimately related to what is going on. So next, I think two, three, Doctor Awan, your next two, three slides is gonna lead us into that sort of conversation. What's the
Yes.
types? Why is the blood pressure important? Why do we have to act fast? Doctor Awan.
Yes. Let's move on to the types of stroke. We have the two most common types of the strokes, and the third one is not that much common. Let's go on with the first one. That is ischemic stroke.
Mm-hmm.
That makes up about 87% of all cases. What is basically ischemic stroke? In this, a clot forms in the
Sure.
blood and which prevents the blood and oxygen from reaching to an area or the specific area of the brain, which as a result causes the damage of that particular area, and then the parts of the body which are controlled by the area are affected. And then moving on to the second type, that is hemorrhagic stroke. As you can also see here, there is a clot in the blood vessel, and then uh, you can see that obstruction. So the particular part of the brain will not receive the blood, and it will cause the death of the brain cells there. Then moving on to the hemorrhagic stroke. This stroke occurs when there is a blood vessel rupture, and as you can see in this picture here, there is a rupture in the blood vessel, and then the blood is leaking out of the blood vessel into the space. So next is transient ischemic attack. Some people also call this condition as a mini stroke. And why is it so? This occurs when there is a blood flow to the part of the brain is adequate for a brief period of time. Like, it is not for the long time, and it is just for a short amount of time, and the symptoms resolve without any treatment because, as you can see, that there is a clot, and then it will resolve on itself after some time. So this is an example of transient ischemic attack.
Excellent. Excellent. So does that might clarify? Two types we have to remember more than the third one, and she's going to re-emphasize them. One is a bleeding type stroke. In simpler terms, it's called hemorrhagic, but a bleeding stroke. You've bled into the brain, part of the brain, most of the brain, some part of it, and that has resulted in a stroke. So you got to stop the bleeding. If you don't stop it, you're dead. And then the second type is where the vessel blood supply is cut off, mostly from a clot that has now occluded the blood. So there's no distal distal flow. The blood supply to the brain is cut off. So one is more blood supply, excessive blood supply, or blood supply that's been cut off. And then the second type is in which you have a obstruction of the blood flow completely. Two types. So remember that one is more flow, one is no flow. And that's why when you go in, the second part is gonna she's gonna show us a few more details on that, but then we're gonna identify why we gotta differentiate between the two, and that's a very important part. So go
Yes.
on, Dr. One. That's quite brilliant. So tell us first about the one that there is no blood flow. That's called ischemic stroke. In general terms, it's a ischemia. Please.
Yes. Uh, First type of stroke is ischemic stroke. And in this type of stroke, what happens is that there is some blockage or narrowing in the arteries that are particularly providing the blood supply to the brain, which then in result causes the ischemia. Ischemia means that the blood supply is not reaching there. And as a result, sometimes what happens that blood clots are often formed in the arteries which are in the brain, and sometimes it lodges from the other parts of the body to the brain. And then sometimes what happens that fatty plaque deposits within the arteries, and they can also cause the clots that result in ischemia. So as you can see in this picture here, this is the artery that is supplying to the brain. As you can see that this particular part, and here there is a clot.
So you
And
have a
because of this,
clot. You have a clot that is going, or you're saying if you have too much cholesterol in your blood vessels, that can get cause
deposited.
obstruction, or there is a well-formed clot that can cause obstruction. So that's what we got to try to keep our blood vessels clean as possible. Try to prevent that cholesterol from depositing into it. Cholesterol can, by the way, get into the heart, or the heart vessels are small, so they can get deposited there, or in the or Dr. Wan is saying you can get them deposited in the brain. The the most important organs of the body. Same issues. Cholesterol, too much sugar, salt, too much sugar is the other one. Same issues. Brilliant. Very good. Very nice. And that picture is very Very, very good as well, Dr. Awan.
Thank you, sir. And the next type is the hemorrhagic stroke. Hemorrhagic stroke is when there is some leak or burst in the arteries that give rise to hemorrhagic strokes. Leak blood, what actually leak blood do? It puts the pressure on the brain cells and damages them. It also reduces the blood supply that can reach the brain tissue after the hemorrhage. And the blood vessels can burst and spill blood into the brain or near the surfaces of the brain. And this may also send blood into the space between the brain and the skull. And here you can see that having hypertension, experiencing physical trauma, taking blood thinning medications, and having an aneurysm can all make a blood vessel leak or burst.
Beautiful.
As you can see in the picture here, this is the artery that is supplying this part of the brain, and here is the leak. There is a burst or the rupture in the artery supplying this area, and blood is leaking out. And what happens? That blood will accumulate here in this part of the brain and will put the pressure on the other matter as well. And then the blood supply to this part will be compromised as well. Because of that, the brain cells here will die and will not receive nutrition enough to survive.
Fantastic. Oh, that's wonderful. So that makes sense. So you're having bleeding in the brain. You got to stop the bleeding. That's what she's saying. And then you want to make sure that the blood pressure is not too high, so you don't bleed out fast. Because the higher the blood pressure, more bleeding. And then you got to quickly stop the bleeding, because the in the other parts of the body you can bleed out and you can control it. But if you're in the brain is already very tight organ. So anything that bleeds into it puts too much pressure on the brain. And so what will happen if there's a lot of bleeding and pressure on the brain? Yeah, it causes herniation. It actually descends down. Too much weight. To blood causes weight causes it to descend down, and then everything, you die fast. Your brain, it's sort of like calling herniation is like sinks, because it's supposed to be a light organ, and it's supposed to be light and weightless, and when there is blood in it, the blood sags it down, pulls it down. It's pretty dramatic, and that's why sometimes we take fast steps, try to get the blood pressure down dramatically so it doesn't start pushing, bleeding stop. But the key is you got to control the bleeding. Very nice. That's a beautiful picture, Dr. Awan. So we know now we got two main types that you've said: the ischemia and the hemorrhagic stroke. That's the one you've called the too much bleeding, and the one that there is no blood flow.
Yes, blockage of the blood.
Blockage, yes. So let's go to the next slide.
Okay. So another thing that is that happens is transient ischemic attack. As you can guess with the word transient, that is, it is for the short time. So what happens in the transient ischemic attack? That is only briefly interrupt the blood flow to the brain, and they are similar to the ischemic strokes in that matter because there is sometimes a clot there. But people should treat them as a medical emergency if even if the symptoms are temporary, because when transient ischemic attack happens, then it is a warning sign for future strokes, and it indicates that there is a partially blocked artery or clot source in the heart or the brain is there. As you can see in this picture, artery is temporarily blocked, and you can see the blood supply here but not there, and then temporary reduction of the function, and then there is a site of blockage. What happens? The blood supply to this part stops for some time, and then the blockage release itself without any treatment, and the blood supply will be back. But
So good.
it would be
So this is like a
warning.
temporary thing. It's temporary,
Yes.
but it gets better. So that's good. We got to be aware of that. So take us to the next slide. What is the how are we gonna now sort of like so we go in and we ask the doctors, they're gonna do either a CT. The first thing is they're gonna probably do a CT scan, and then if it is a CT scan, they're gonna They're going to see what is there bleeding going on. If there's no bleeding going on, take us to the next slide, please, about what are the treatment options here. Yes, please.
So there are the various diagnostic tests for, you can say that, the stroke. First of all, what the doctor will do is that physical and the neurological exams. As we have already discussed, be fast. This also includes the physical and the neurological symptoms, neurological examinations. Okay, and the second thing is CT scan. In CT scan, basically, this is a scan of the brain in which all the parts of the brain will be visible, and we
Sure.
can see that is there any blockage or because ischemia is available on the CT scan.
Okay.
And then there will be MRI and carotid ultrasound and also the blood test.
Blood test.
As we have already discussed that we have to detect early for the better production.
Sure. So just walk us through the treatment a little bit, which I apologize, we're running short of time again here, but walk us through just the treatment. So what would you do for the next slide would be what would you do for the hemorrhagic stroke, and what do you do for the non-hemorrhagic stroke, the bleeding stroke, or the one that says no blood flow?
Okay, so for the infarct, that is ischemic blood flow, ischemic stroke, we can have the drug options like aspirin, and then intravenous injection, TPA. TPA is tissue plasminogen activator, and then delivering the medications directly to the brain
Perfect.
and mechanically removing the clot.
So Dr.
What
Dr. Awan,
everything-
that is your clot buster. That
Yes.
is the TPA is the medication that you want to give within 3 hours. That's when it works. That's when it busts the clot. After that, the clot gets organized, Maya. It doesn't, then the medication doesn't work. The number 2 that is there is the one that we want to get in as soon as the possible if there is no blood flow. You have to have some blood flow to the brain. You can't live without blood flow. You could have no blood flow, you're gone. 3 hours, good medication. It has its side effects, of course, but you got to get that number 2 in, which is your clot buster medication. You get that in, or you want to see if you have a number 3 or 4 or 5 or 6 even. But the 7th one, where you 6th and 7th actually, or more so 7th, where you have to do repair of the vessels, is mostly for your hemorrhagic stroke, the one that you have to get surgery involved with. Sometimes they go in and put a clip in the brain. If you have a AV malformation, if you have an artery and a vein that got burst, you can clip it. You can put clips in. It sounds a little bit gruesome. Sorry, I know Maya doesn't like it. But sometimes you have to go in and repair the bleeding. So there's a surgical. So they have completely different treatment. One, you have to open up the vessel. The other one, you have to stop the bleeding. Does it make sense? And I hope it does to everyone else as well. That's what I wanted to put a thrust on. Do you got any more slides, Dr. Awan?
Yes, sir.
So
The rehabilitation.
let's play the video. I think Jeremy has something he wants to show something, and then we can go to the rehab part. It's quite an excellent bit here. So this is another video that he wants to play. Jeremy?
But what have you been on with? What have you been up to?
Yes. But
Yeah? What was that?
I was man.
You alright?
Well,
Dave, listen, I'm just going to go and get someone, alright?
uh,
Alright, just give me a minute. Okay, 1 minute.
Dave, right, Jason, can we move this table out, please?
Yep.
That's it. Yeah. Wait, Dave, can you smile for me?
Yeah.
Okay, Dave. I need you to try and lift your arms for me. And this one? Right, can you tell me your name, please?
No.
Okay. Jason, can you just stay with me? I'm going to call for an ambulance.
Jason, Dave, it's me, alright?
Yes, well.
Just gone to get an ambulance, alright?
Right.
Alright, mate. Just take it easy.
If you think someone is having a stroke, use the FAST test. Face. Look at their face and ask them to smile. If they're only able to smile on one side of their face, it's probably a stroke.
Don't worry. Is it done? Oh, okay. So very good. So I didn't know it got finished. So basically you're saying, I think this video also was emphasizing the same thing. We played it full, right? Right till the end. Is that right? The fast part. So it also was talking about fast, FAST. Is that right? I didn't see the last part of it. Sorry, I apologize. But yeah, okay. So it's also saying you gotta do that. You could be a B fast or a F fast on it. So okay, Dr. Awan, what do you think? The next part. Just walk us through this, please. And so once we know, hey, we gotta act. Hey, we gotta get that person in. Hey, we gotta identify. I think that's the take-home message for us. A couple of more
Yes, sir.
words about your last slides for us, please.
Yes, sir. Actually, rehabilitation therapies are very important because, as we have discussed, that there is a damage to the brain cells, and what happens that they will affect the different parts of the body, as we have discussed past. So there will be long-term effects as well. So rehabilitation therapies are very much important for that, for the recovery part. This includes the physical therapy for the body parts, speech therapy, as in we have discussed the S part of the FAST, and then occupational therapy, cognitive therapy, and behavioral therapy, because the person will face some difficulties for future. So we have to focus on the rehabilitation therapies as well, so they can carry on with their regular activities uh, as as soon as possible. So rehabilitation therapies are very important.
Excellent. Okay.
And lastly, we have the prevention. What should we do to prevent the stroke? As we have already discussed that we have the various risk factors which are very common in our general population. So there are general things which everyone should do, whether on risk of the stroke or not. This includes some making some lifestyle changes, such as eating a healthy diet, maintaining a moderate weight, exercising regularly, and not smoking tobacco, and avoiding alcohol or only drinking moderately. And also adding some nutritious diet, like eating nutritious diet means including plenty of fruits, vegetables, whole grains, nuts, seeds, and legumes, and also limit the amount of red and processed meat in the diet, as well as cholesterol and saturated fats, as we have already discussed, that plaques will be formed and they will cause the obstruction as a result. And also, the most important thing is moderate salt intake to support healthy blood pressure levels. As we know that blood pressure is the most important cause and the most important risk factor for stroke. So, controlling the salt intake is also very important. And then, if you have following conditions, then be very careful, and we have to take measures to reduce the risk factors, like controlling the blood pressure levels, managing diabetes, and getting treatment for heart disease.
So we have a
And
brilliant
as well as
question from
yeah.
while you're on the rehab part. Someone's asking, is stroke always fully recoverable? What's your thoughts?
Sir, not always, because it also depends on the area of the brain that is affected, like the intensity of the damage. Sometimes
Very
what
good.
happens is some of the things are recovered by these therapies, but few things are just irreversible.
So, for example, so you're saying that's why you gotta act fast. Stroke,
Yes.
TIA, TIA is fully recoverable. Once you've had a what she called a mini stroke, it's sign for you now to be alert for the rest of your life. You have a problem, and that's because the next stroke is going to be devastating and may kill you. So that's point number one. So TIAs, if it is temporary, it was transient, and you recovered, you got a second warning, you got a second life, you got to act. Now, there are the other two types. If you can't control the bleeding and you weren't able to act, you're not going to recover. There's no going back, unfortunately. And then the other type, the last type, where we said that the blood clot prevented or there was no flow, it affects which part of the brain it's affected. So if it just affected the arm part, your arms are not going to work. They may work some, but they may never recover because you weren't able to act quickly enough. Same is with the legs. Sometimes, a lot of times, we see these patients can't control their urination, defecation, so their bowels and stuff have a problem. Others have started having infections. Some of the strokes may just affect the eyes. Again, you gotta act promptly and open the blood supply to it. And if it doesn't, the eyes are not gonna recover if they're dead. So it's a little complicated question, but a very, very good question. Yes, it absolutely depends on one. We said there are two types. It could be bleeding or it could be the non-bleeding type. The bleeding type, you know what you gotta do. The non-bleeding type, you gotta open up that blood vessel, and if you act quickly, that area that was damaged is gonna get better. And it will slowly recover. There is chance, but if you act late, you let it die, it's regressed, you're not gonna be able to recover. So that's why it's very, very important. I think that was a brilliant question. Just that Dr. Awan was on this question. Dr. Awan, that I think was quite a brilliant presentation. We really, really loved it. And I think all of us appreciate you preparing and doing a fabulous sort of job. I think there is a couple of messages that we want to give to our listeners. First one, Jeremy, I think you're going to put up is from the last podcast, where the winner of last podcast was Dr. Wajiha Awan. We just want to thank her for doing such a brilliant job. So well done, Dr. Safia, for Dr. Mariam, for doing a sort of like fabulous job on your blog, I think. So you've been nominated as the winner of it. Next week's topic is going to be on anemia and why is it important, and we're going to do a discussion on that. Anemia, what's the causes, how to recognize, and what are the treatments. So very, very important topic. So Dr. Safia is going to be giving us a talk on this. And then for April, till the last bit is on the blog for next week, the question and assessment that is going on. And the question that we have for this week is on your screen. I think it is, have you looked after or seen a stroke patient? What challenges did you face, and how will you adjust your approach this time around that you've listened to the talk? So please put your responses on by April 18. I know Ms. Tyra will be looking for your responses, which then the team will be selecting the best response about this. Let me repeat the question one more time. It's, have you looked after or seen a patient with stroke, and what are the challenges, and how will you act differently? And then you have approximately 6-7 days, April the 24th or 25th. 25th, Thursday. By next Thursday, we want all the responses in. That's what she's saying. Maya wanted to know the date. So the date is April 24th, but the sooner you put them in, that you're in a better position to contest. And we want all of you to put your assessment in and give us a feedback the last thing, a message from Dr. Hamza was about, hey, please make sure you like and subscribe AMT and the Khan Clinic program. It's very, very important that you do that so that we can continue providing you with updated information and talks about this. And lastly, I want to just say that I want to just thank my in-studio team for doing just this very splendid job. They've come a long way just in the last few months. Jeremy, Maya, Rida, Zalika, Hamza, Hafsa, Farhana, and all of them, they do quite a smashing job, including Ms. Tyra and Banish. I just want to thank you very much, Dr. Awan. Thank you for coming on board. It was quite brilliant presentation, and thank you everyone else who've done sort of like a marvelous job in participating. We really look back for your feedback. Do give us feedback how we can make this better, how we can improve, and we want to try to get in as much as good information, robust teaching to you guys. All right, thank you and have a good weekend. This is Dr. Khan signing off from Khan Clinics, which is powered by American Muslim Today. Thank you.